Perjury. You do. Please be seated.
Good morning, Ms. Gosselin. Would you please state your full name for the record?
Alexandra Catherine Gosselin.
All right, ma'am, I'm just going to ask you to keep your voice up. It's a big room and everybody needs to hear you, okay?
Sorry.
Sorry.
And what was that first name again?
Alexandria Catherine Gosselin.
Okay. And can you spell your last name for the record, please?
Gosselin.
Thank you. Ms. Gosselin, where were you working on 12/26 of 2022?
At Catholic Medical Center.
What was your role then?
Emergency Department registered nurse.
But what kind of education and training does it take to become an emergency department registered nurse?
I have an associate's degree in nursing as well as a bachelor's degree in nursing.
Okay. And what kind of work experience had you had up to that point?
As a new graduate, when I first started my nursing career, I worked on the IV team up at Dartmouth Hitchcock in Lebanon for 2.5 years.
Did you say IV team?
Yes.
What is that?
It is a team of nurses that go around the hospital and the clinics placing IV catheters or intravenous catheters into patients that need different medications infused.
And how long did you say you were there?
2.5 years, I believe.
Okay. And what came next?
And then I came to Catholic Medical Center in the emergency department.
So by December of 2022, how long had you been at Catholic Medical Center?
2 years, a little over 2 years.
Were you working at CMC at 1:45 a.m. on December 26th of 2022?
I was.
And you were working in the emergency department?
That is correct.
Okay. Do you remember a baby being brought in for emergency care at that time?
I do.
Was there just one that night?
I'm not sure.
Do you remember any others?
No.
Okay. Do you remember what the baby's weight was when he was admitted?
I do not recall.
Okay. Would it help refresh your recollection if you saw your notes?
I believe it would, yes.
I'm handing you what's been...
Different
body temperatures as they change over the course. I'm handing you what's been marked as State's Exhibit 23 for ID.
Thank you.
Do you recognize that?
I do.
What is that?
This is part of the medical record
Okay.
and documentation.
Are those your notes?
That is correct.
And when are those notes from?
From December 26, 2022, during patient submission.
Okay. And is that the baby that was brought in that evening?
That is correct.
I guess. Okay, can you take a look at those notes and refresh your recollection as to what the baby's weight was when he was admitted? I'm just going to point you to the page 15.
Two kilograms,
Can you tell us what that is in pounds or ounces? Because I can't do the conversion.
4 pounds,
4 pounds and how many ounces?
6 ounces.
4 pounds, 6 ounces? Okay. And do you recall what the baby's condition was when he came in?
The baby was non-responsive when he came in, and CPR was being performed by the first responder.
Okay. And how do you categorize that in the emergency department? What do you call that condition?
He was in a code blue, so he was receiving CPR.
Okay. Could you describe his appearance?
His arms and legs were flaccid, and he was bloody and covered in dirt. And when they walked in, the first responder had him in her hand and was performing one-handed compressions while walking into the trauma bay.
Okay. Can you tell me what his color was?
Dark reddish color.
Okay. What does that tell you, if anything?
He's not circulating his blood very well, very cold in appearance as well.
Your Honor, I'm sorry, I can't hear. If you could just keep your voice up, please.
Sorry.
What did you notice about his eyes?
His eyes were not open the first time I saw him.
Did his eyes open while you were with him?
His eyes opened later on, right before he was transferred.
Was that the same morning?
It was hours later.
When you first saw him, was there any movement?
No.
What were you treating the baby for when he first arrived?
We were treating him for hypothermia.
Okay. And what was that treatment?
We were warming him with hot packs, and we put him in an infant warmer that creates radiant heat to bring his core temperature up.
Okay. Did you record his core temperature?
I did. Well, I recorded his temperature.
Oh, I'm sorry. How's that different?
A core temperature is inside the body. With an infant as young as he is, it's not safe to take an internal temperature, or like we would on a normal sized infant, we would take a rectal temperature, but where he was prematurely born, a rectal temperature would not be safe due to the risk of perforation. So when babies are this small and this young, we take a skin temperature.
Okay. Does the skin temperature normally correlate to the internal temperature in your experience?
Your Honor, check that foundation. She did. There's a foundation for this question.
Sustained.
Over the course of your, it sounds like 4.5 years of being an RN, do you normally take both internal and skin temperatures?
Skin temperatures are only for premature infants that are in a warmer.
Okay. So there's no other circumstance where you would just take a skin temperature from someone?
There are the abilities to do like the thermometers over the forehead, but
Is that a skin temperature?
that would be a skin temperature, yes.
Okay. And does that ordinarily correlate to internal temperatures that you
Objection.
use some other method for?
Same objection.
Approach.
Okay. So you've taken skin temperatures from patients, right?
Okay, I'm sorry, you have the
Yes.
verbal answer. Thank you.
And you've taken internal temperatures from patients, right?
Yes.
Have you had patients where you took both a skin temperature and an internal temperature?
Yes.
In that instance, or in those instances, when you took both a skin temperature and an internal temperature from the same patient,
Objection. Relevance.
Overruled.
in those instances, did the skin temperatures correlate to the internal temperatures?
The internal temperatures is generally a few degrees warmer.
Thank you. And when you say a few degrees, what do you mean?
It can vary, but in my experience, it's usually a 3 to 4 degree difference or so.
Okay. So the skin temperature, in your experience, is typically 3 to 4 degrees warmer than the internal temperature, or vice versa?
Vice versa.
Oh, okay. I'm sorry. So the internal temperature, in your experience, is typically 3 to 4 degrees warmer than the skin temperature?
That is correct.
Okay. And on this particular baby, on December 26th of 2022, you were taking a skin temperature.
That is correct.
So we would expect that skin temperature reading to be 3 to 4 degrees cooler than the baby's internal temperature.
Correct.
Can you tell me, what time did the baby's first body temperature get recorded?
Your Honor, if she's going to refresh her recollection, she's just looking at her report now by herself.
I'm sorry. So, yeah, so you
Am I allowed?
can refer to your report, but only to refresh your recollection. So if you're going to do that, just let me know that you don't remember.
I'd like to know what part of the report she's referring to refresh her recollection.
I'm going to look in the code blue flow sheets because that is where it would be documented.
So you should be looking at page 20.
Refresh for a second.
Yes.
Did you refresh your recollection?
I did.
So what was the first time that you recorded a body temperature?
At 2:20, the first recorded temperature was 82.7 degrees Fahrenheit.
Okay. And do you know what time the baby came into the hospital?
I do.
What time was that?
1:45 in the morning.
Okay. And so from the moment that the baby came in until the moment you first recorded that body temperature, were you present for that?
I was.
And what were you doing?
There was a lot going on. We got the baby in the warmer. CPR was being performed. It takes some time for the machine to register a temperature. So this was the first temperature that the machine was able to register.
Okay. So for that 35 minutes, you had the baby in a warmer?
That is correct.
Were you doing anything else besides that to increase the baby's body temperature during that first 35 minutes?
Yes, the baby had hot packs underneath him and on the sides. The warmer had the light right on top of him, warming him, and the room temperature was increased as well.
Okay. Do you know how low a baby's body temperature can go?
I don't.
I'm going to check the foundation on this also.
Overruled.
Okay, what was the next time that you recorded a patient temperature?
I'll have to refer to my records.
Okay, if you could look at page 18, which is page 199. I'm sorry, I'm going to withdraw that question. At 3:50 a.m., there's a note in your report that says, we did 3 rounds of epi and PPV at 28 of pressure on 100%. Do you see that note?
I do.
What does that mean?
That was not recorded by me.
Okay, what does that mean, though, if you know?
So this is a note from a respiratory therapist, and she was documenting the positive pressure ventilation of the vent that was breathing for the baby at that time.
Okay, and is that a tube?
Yes,
Does that mean that the baby was intubated at that time?
that is correct.
Okay, can you tell me at 2:25 a.m. what the baby's temperature was?
I will have to reference my records.
Could you refer to page 13, Bates 194?
At 2:47, the patient's temperature was 88.7 degrees Fahrenheit.
Is that hypothermic?
Yes,
Okay, and at that point, the baby had been in the hospital with the warming for over an hour?
that is correct.
Still the heat packs on him?
Yes,
And in the warmer?
yes.
Okay. It looks like the last body temp was about 2 minutes before 4 o'clock, is that correct?
If I can reference my notes again.
Please, on page 10, number 191 Bates.
And you're asking at 4:24 a.m., is that correct?
Yes.
At 4:24 a.m., the patient's temperature was 93.2 degrees Fahrenheit.
And what's the normal body temperature for a newborn?
98.6 degrees Fahrenheit.
Okay, and that body temperature was hours after his arrival, correct?
That is correct.
And was the treatment the same throughout his time at CMC?
Yes.
No further questions.
Hi, Ms. Gosling.
Good morning.
We've met before.
Yes.
I'm just going to ask you a couple questions, okay?
Yes.
Is it okay if I just stand here?
Yes, you can.
All right. So, you are not any kind of a neonatal specialist, correct?
Correct.
You don't have any specialty in pediatrics, correct?
Correct.
You don't have any specialty in pediatric emergencies, correct?
I have a certification in neonatal resuscitation.
Okay. Is it just resuscitation that you have a certificate in?
I also have pediatric advanced life support certification as well.
Okay. And you do have a specialty in pediatric vascular access.
I do.
Correct. So if you have a total specialty, that's the main specialty you have.
Yes.
Is that accurate?
That is correct.
Okay. And that's knowing how to put an IV or an IV lead into a small child.
That is correct.
Right. And you didn't do that for this
No.
baby?
No.
Right. Okay. So you didn't perform any vascular procedures on the baby we're talking about?
I did not. The provider did.
Excuse me?
The provider did.
Okay. Right. You were not providing or making orders or any of those things?
That is correct.
Okay. And a lot of what you did was enter data into the computer.
That is correct.
Right. So you took notes from other doctors, not other doctors, but from doctors and other people and put them in the computer?
Yes.
Okay. And you did do a couple things. You gave the baby vitamin K,
Yes.
right? That's a standard thing you give babies.
Yes.
Put erythromycin in his eyes.
Yes.
That's standard.
Yes.
Okay. And obviously you took his temperature.
Yes.
Right? Were you the only one taking the temperature?
The temperature is being constantly recorded by the machine.
Or when you say the machine, what do you mean?
The kangaroo infant warmer.
Okay, so when a baby needs to be warmed, they're in the machine, the kangaroo warmer, and does that have like an electrode that goes on the baby, or how does it happen?
It has an electrode that attaches to a sticker that is on the baby the whole time.
Right, and so that whole time you're taking a skin temperature, correct? Is that a skin temperature?
Yes.
Okay. Because you said your core temperature has to be taken, like it sounds internally.
Yes.
Right, and that never happened.
Correct.
Okay. And that was because he was so small.
Yes.
Right. In doing the treatment that you did, that's not something you do on your own, right?
That is correct.
Okay. So you are there to carry out the doctor's orders.
Yes.
Okay. And during this night, during your shift, was this the middle of your shift, or the beginning or the end?
In the middle.
In the middle. Okay. The baby was being prepared to go to Dartmouth Hitchcock.
Yes.
At the end.
At the end, yes.
Yeah. So at some point, the decision was made when he was stable enough, he was going to be moved.
That is correct.
So, and when he was stable enough to be moved, he was moving his extremities.
That is correct.
Okay. And he was peeing and pooping.
Not
Had that happened?
Not that.
Yet. Okay. But he was stable enough to be moved and taken up to Lebanon.
That is correct.
Okay. And then you're caring of him.
Yes.
All right. That's all. Thank you.
Anything further?
Thank you.
Can they sit down? Attorney Sweeney, if you would take the report from her and return it to the court monitor, please. And ma'am, just be very careful of the wires, okay? Thank you. A big room, so please keep your voice up as you answer questions. Thank you.
Yes, ma'am.
Good morning, Dr. Lennon.
Good morning.
Could you state your full name and spell it for the record, please?
Sure. Bridget, Brigid, Mary, Mary, Linnan, Linnan.
Thank you. Dr. Lennon, can you tell us a little bit about your background, starting with your education?
Sure. My undergraduate degree at Boston College. I went to medical school at Albany Medical College. I did my residency at Eastern Virginia Medical School in emergency medicine. I finished residency in 2008, was board certified as soon as possible in 2009, and I've been practicing as an emergency medicine physician, residency trained and board certified emergency medicine physician since then.
Okay. Can you tell us about your residency?
I did 3 years of training in a academic center in Southern Virginia, where we learned about all of the different aspects of emergency medicine.
During your residency, did you learn about pediatric ICU?
Yes.
Did you do rotations there?
Yes, we did rotation in both the NICU, the neonatal ICU, and the PICU, which is a pediatric ICU.
Since your residency, have you further developed your PICU and NICU skills and knowledge?
I believe so.
How so?
Through my practice, I see patients, I see probably 15 to 20 patients every single shift, if not more. And throughout the number of years that I've been practicing, I have had the opportunity to take care of a lot of patients in that situation. I've also continued my continuing medical education.
Okay, so you're not board certified specifically in pediatric emergency
I'm not.
but you're certified more generally in just emergency medicine?
Yes.
And what age range does that cover?
Birth till death.
Can you tell us about your work experience?
Sure. Starting 2008, when I finished residency, I went to work for the group that I trained with in Virginia. I worked there for a couple of years. I then went to a small community hospital in North Carolina and got to work there. It was a very different setting. I then moved to California. My husband was in the Navy, so we moved to California. I worked at the busiest emergency department in Southern California for 4 years at Grossmont Hospital. And then in 2018, we moved back to the East Coast, started working at Catholic Medical Center, and I have worked there since then.
Your Honor, I ask the court recognize the witness as an expert in emergency medicine.
Objection?
No objection.
All right, the court finds this witness qualified.
Thank you. So I want to take you back to the early morning hours of December 26th of 2022. Do you remember that morning?
I do.
Were you working a shift at CMC that morning?
I was.
Do you remember any of your patients from that morning?
I do.
How many patients do you remember from that morning?
1.
Okay. Was that baby Eckersley?
It was.
Okay.
Objection.
Basis?
It's not in her record, but she knows that. It's not in the record. The report.
So, foundation?
Foundation, yeah.
Do you want to lay a foundation?
I'll move past that, Your Honor. So this one baby that you remember from that night,
Yes.
did you have any information about the baby before he arrived?
Just prior to coming in, we got a call that there was an infant that had been, what we were told was found in the woods. After being exposed to cold for a while, it was a brand new newborn, and that the child was in significant distress. That was all we knew.
Okay. Any information about how far along the pregnancy was?
There were reports that Mom had said that she thought she was between 3 and 6.
We object to this as for hearsay and foundation.
Yes? It's stricken from the record.
Where were you the moment you first saw the baby?
I was entering our trauma resuscitation bay.
And what was the volume of patients like in the CMC ER that Christmas night?
Moderately busy.
When you saw the baby for the first time, did he get in line with the other patients?
No,
Okay. Was he staged behind other emergency patients?
absolutely not.
Was there any delay between the baby's entry to the hospital and the beginning of his treatment?
No,
Why not?
because the baby was immediately identified as the sickest patient in the department.
Okay. So were you in a big hurry to treat this particular patient?
Absolutely.
Over all the others?
Yes,
Would you say time was of the essence?
absolutely.
Can you tell me, did the baby have fingernails?
Yes,
Did the baby open his eyes that morning?
yes.
What does that tell you about the gestation period of the baby?
Fingernail development begins early However, by the time there are fully formed fingernails on an infant, they are usually between 32 and 34 weeks, sometimes up to 36 weeks of gestational age.
Okay, so the fingernails tell you that he's somewhere between 32 and 36 weeks?
Yes.
Did the baby open his eyes that morning?
Yes.
What does that tell you about the gestational age of the baby?
That the baby was at least 30 weeks.
Okay. It sounds like a minimum of 32 and a maximum of 36.
Yes, sir.
Is that 8 months along? Am I doing the math right?
Yeah, 40 weeks is full term, so 36 is about a month. Yeah, so we're looking at between 7 and 8 months.
Okay, so was he a small baby?
For a newborn baby, small, yes. For a gestational age baby born at between 30 and 36 weeks, a little small, but not tiny.
Where did the baby go when he was brought in the door?
Immediately came into our trauma resuscitation bay and into an isolette, which is a warmed examination and treatment table that we have for newborns.
Were you with him when he came in?
Yes,
When the baby first entered the ER, who had overall responsibility for him?
I do. And my team.
Okay. Where did you start?
We started by trying to obtain some basic vital signs.
What did you find out?
We were unable to palpate a pulse. However, the baby did appear to have what we call agonal respirations, just barely trying to make an occasional breath. And we were unable to obtain a temperature because he was too cold.
So what did you do about that?
We immediately placed him in where we had him in the isolette, which is a warming. We use warm blankets. There's a light warming them. We started CPR immediately, and I started to get the equipment together in order to intubate to establish an airway so that we could breathe for the baby since he wasn't breathing effectively on his own.
Okay. Is that respiratory distress?
Yes. I also activated a code NOAA in the hospital, which means a newborn baby is in distress, and activates the team upstairs in the neonatal ICU so that they can assist.
Were you able to determine what caused the respiratory distress?
No.
Did you maintain overall responsibility throughout the baby's time at the hospital?
I did not.
Did the baby leave the hospital that morning?
Yes.
Where'd he go?
He went to Dartmouth to their neonatal ICU
How was he transported?
via EMS emergently.
When he left the hospital that morning, was he still hypothermic?
Yes.
Why transfer him up to Dartmouth?
Because they have a more robust neonatal ICU program with more resources available to treat a baby that sick.
Was he still in jeopardy when he left you?
Absolutely.
Nothing further.
I don't have any questions for this witness.
You may sit down.
Thank you.
Please be careful of the wires. We can just ask that you keep your voice up as you're answering questions.
Okay.
Thank you. Attorney Eckersley, you may proceed.
Good morning, Ms. Packard. How are you?
Good morning, I'm well.
If you could please state your name and spell your last name for the record.
Pamela Packard, Packard.
And are you currently employed?
I am.
Where?
I work for the New Hampshire, State of New Hampshire E911,
And how long have you been working there?
almost 20 years.
Do you receive any training to be an E911 dispatcher?
I do.
Okay, can you describe that training briefly?
When you start, there is about 6 weeks of classroom training where you learn a lot of different elements of the job, a lot of classes within that time frame of different training. And there's also 6 weeks where you're working with another dispatcher who is a training officer that teaches you the job before you are on your own taking calls.
Is your training ongoing as you continue on with your?
Yes, there's training almost every month. There's a training or two throughout the year.
So can you describe some of your responsibilities?
Well, I take a call and I determine the location, the nature of the emergency, and dispatch the proper personnel.
Who do you take a call from?
Anybody who's having an emergency.
Okay, and
If
you don't
anybody that
know
dials
these people?
911, Sorry, Attorney Eckersley, make sure you're not talking over each other, please.
I'm sorry. Go ahead.
Anyone that dials 911.
Yeah, you don't know these people personally.
Normally not.
And are you reliant on what they are telling you is happening?
Completely.
Now, you just mentioned that you were, or that you are employed by the state.
Yes.
So where are you based out of when you report to work?
My base is out of Laconia, New Hampshire.
Can you just explain the difference between, or how the process works for when you take a call and you relay that information?
When somebody dials 911, the first thing we want to do is determine where they are and then the nature of their call. And going forth from there, if it is determined to be a call that requires law enforcement, we immediately dispatch to the law enforcement dispatch that answers for that area.
So if I may break that down a little bit then. So you receive a phone call and you gather information?
Yes.
And what is the purpose of that?
To find out the nature of why they're calling. Sometimes if somebody's calling and they just have a question, you want to determine whether they're calling for an emergency and you're going over on an emergency line, or we can transfer on a non-emergency line, so we're not tying that up.
And is that caller the person who you're relying on to provide you that information?
Yes.
Are you relying on that caller to be honest with you when you're taking that information?
I am.
And are you relying on that caller to give you all pertinent information so that you may assist in your determination of what type of emergency there may be?
Yes, I am.
Or whether there is one?
Yes.
So then based upon that reliance, are you assessing the call and the situation in real time?
Yes.
Now, you mentioned that you relay or pass along that information.
Right.
Okay, so now you're in Laconia, correct? So where do you pass that information along to?
It depends. The dispatch that's taking calls for the location the caller's emergency is.
Okay, so just for example, if you get a call from someone in New Hampshire,
Objection.
Basis?
He can pose a hypothetical.
Okay. The approach?
so how do you determine where to call or alert first responders?
By the caller giving me the information of where the emergency is.
And by where the emergency is?
Right.
Okay. After you receive the call, are you alerting the area dispatch directly?
I'm sorry, can you repeat that?
So is it a direct line of communication from you to the area dispatch?
Yes.
Do you speak with the first responders at all?
No.
You know, I just want to understand, you are at the state level,
Yes.
and the dispatchers are down in the city or area level.
Right.
Now, after you receive information from a caller and you pass along the information, do you remain on the line with the caller?
Sometimes.
Okay, and for what purpose?
Usually for medical reasons. We don't stay on for fire or police calls because it isn't an ongoing or event-changing thing. Somebody who is in a medical could have a situation where things could change rather quickly, and if you're not on the phone with them and they're not able to call you back, you're not able to update with the information.
Okay, so it's in part because a person is in medical distress,
Yes,
and then it's also in part so that you can relay information if you need to.
correct.
When does the call typically end?
As soon as the rescue arrives, if it's a medical call that I'm staying on for.
And after you hang with the caller, do you typically have any further involvement?
No.
Okay, so I just want to, again, establish you're relying upon the caller.
Objection asked and answered.
Overruled, but it is leading, so to that
so-
extent it's sustained, you can re-ask the question.
So, again, who are you primarily reliant upon?
The caller.
Now, were you working in your capacity as a 911 e-dispatcher on Christmas night 2022?
I was.
Just before midnight, did you receive a call regarding a woman giving birth in the woods?
Yes.
And prior to testifying today, did you have a chance to listen to the recording from that night?
Yes.
Your Honor, if I may approach the witness.
Yes, you may.
Your Honor, if I may approach the witness, what states Tip 24 is the mark of identification.
Yes, you may.
Okay, now, Ms. Packard, place something in front of you. What is that?
That is a CD.
Okay, now, if you may look at the bottom here, what is the CD of?
911 call audio.
Okay, now, is this a CD that you reviewed
Yes.
prior to coming here today? Okay, and to your knowledge, that CD was true and accurate to the 911 call as it was, as you received it on that night?
Yes.
If I may move, Your Honor, to move this to admit this as a full exhibit, published to the jury.
Any objection? No objection. The ID is stricken, it's entered as a full exhibit and may be published to the jury.
Now, Ms. Packard, just before I get into the audio, I just have a couple of other questions here. You testified previously that you determined the location and nature of the call.
Yes.
Okay, do you notify law enforcement specifically?
Only when it's a call where police are required to be there.
Secretary Eckersley, you need to be in front of the microphone for recording purposes. Thank you.
So do you notify police specifically?
No,
Okay, is that dependent on the call?
it depends on the call.
Okay, and on this night, did you notify the police?
I did not.
Okay, who did you notify?
The fire dispatch for Manchester,
And why was that?
because they're the ones who send the rescue to where the call is.
Okay.
Conversation recorded on Monday, December 26, 2022, 24 minutes and 12 seconds.
Miss Emma, what's your emergency?
Can you just hold on for a minute? Is that you accepting the phone call?
Yes.
Okay.
Okay, where are you exactly, sir? Okay, are you right in front of it, inside, or?
Okay. Now, where did that? So is that a male caller or a female
That
caller?
was a male caller.
Okay, and where did the male caller say that he was located? If you could hear it.
I didn't hear it.
Okay, if we could go back and replay. I just asked if you could to pay attention. I just asked if you could to pay attention. I know it might be kind of hard of hearing sometimes. If you need to, I can have you come closer to the TV to hear it. But yeah, go ahead.
Okay, are you right in front of it, inside, or? I'm sorry, sir? By the trestle? Okay.
So where was the caller calling from?
By the Trestle Bridge.
Okay, near the West Side Arena?
Yes.
And what town? Okay. And your phone number, that's in Manchester, one electric drive by the trestle, by West Side Arena. What's the phone number for you?
858 480 6951.
Okay, I'm just going to confirm, 858-480-6951. Tell me exactly what happened.
Well,
Tell me what happened.
Now, is that a female caller that you are now speaking with?
Yes.
And what is the purpose now of your conversation with her?
To find out what the call is for and what's going on in the situation.
I didn't know there's no way of them call. And I just talked out the kids. So,
Okay, they're already being notified, okay? All right. I need you to tell me exactly what happened.
okay.
Okay, are you by the trestle or are you by the ice arena? Are you by the arena or the trestle? Sorry, it's just breaking up. You're by the trestle, okay.
Now, where did she say her location was?
By the Trestle.
Stay there, okay, so we know where exactly you are. Okay. Did you already have the baby?
No.
Okay, I'm just confirming, okay, so they're being notified. All right, I'm sending for Manchester. I'm sending for Manchester. Ambulance, stay on the line. I'll come back in a minute.
Now, who are you sending for?
The Manchester ambulance.
Why?
Because she was having a medical emergency.
There is a trestle down by the ice arena off 1 Electric Avenue. I don't have a determinant. I had a hard time.
Okay, so you just mentioned a word in there, determinant. Can you explain what that is?
Determinant is a part of a code that we give to dispatch. It gives them a level of the priority of the call.
Okay, and why didn't you have a determinant here?
Because I hadn't asked all pertinent questions at this point.
Okay. Now, you relayed some information to Manchester Fire?
Correct.
Okay. They're located in Manchester?
Yes.
Was that information that you relayed based on what the caller had been telling you?
Yes.
I'm getting information. It's my first caller. I have a female on the line saying she just gave birth. She didn't know she was pregnant.
Well, maybe I was a month along.
What did she say there, if you could hear it?
Maybe I was 1 month along.
Okay. Previously, she mentioned how far along she was, correct?
She said she couldn't be 9 months.
Okay, but now she's saying 1 month?
Yes.
There's no way I was any more than that.
And she's under the
No
trust.
way at all. Yes, I was getting ready to pass the entrance. There's also on the side of the Western Street.
Okay.
And did she confirm there for fire where she was?
Yes.
All right, we'll be right there.
Thank you. All right, ma'am. How old are you? 36?
20.
Okay. Okay. Yep, they're on the way, okay? Just stay right on the line with me, okay?
Thank you very much.
All right, how many months pregnant are you?
There's no way I'm going to say.
No more.
Okay, so how many months pregnant did she say she was then?
That there was no way she was more than 3.
More than 3 months?
I need to know.
Okay.
And I wouldn't know, no.
Yeah, I understand. Is there any serious bleeding?
They are going to the court coming out. I just, make sure paper around here. That was kind of pressure on them.
Gonna try and keep pressure on the cord? Is it just
On
the cord that's...
yeah, I the coordinates. What they got when you have the case.
Right.
Still hanging out.
Okay, where's the fetus?
On the ground.
Do you have any height?
Now, you mentioned a word to her there, fetus.
Yes.
Why did you use that word?
Because at this point she was stating she was no more than 3 months pregnant, which would make it a non-viable fetus.
Did she tell you whether or not the baby was crying when she gave birth?
No.
Had she done so, would that have changed how you approached the call or analyzed the situation?
Yes.
Where did she say that she was, or excuse me, so you asked her where the baby was.
Right.
Where did she say it was?
On the,
I could replay it if you
yeah,
have trouble.
probably.
Right.
Still hanging out.
Okay, where's the fetus?
On the ground.
Do you have any height?
Were you able to hear that?
Yes, on the ground, and I'm not sure if she said other trussel or under trussel.
Did she say that was in a tent?
No,
Did she say that it was at her camp?
No.
Or at a camp?
no.
With complications?
No, it's good.
Okay, so they don't have the...
It's just going kind of, right now.
Okay, well, like I said, we do have help on the way, okay?
Thank you very much.
All right, I want you to...
Now, up till this point in your conversation with her, was she answering all of your questions?
Yes,
Was she, were you appropriately relying on her and what she was telling you?
yes.
Do you have any reason to believe or mistrust what she was telling you?
No,
Assume the most comfortable position and take
I'm
deep
doing my
breaths.
best. I'm doing my best. Thank you very much.
Okay, all right, so you're not near where the fetus is, right?
No, I couldn't.
No, I
because
can
the court said the court tried to make sure that I went through.
Okay, I understand. Is there...
I'm not going down my back towards my fetus to be able to go. And
No. Actually, play through a little bit.
his own charge out to the court. Thank you.
So, you had asked her whether or not she was near the fetus, and what did she say?
she said no, she left it,
And what did she say after that about her boyfriend?
that he went back to, and I didn't hear exactly what the words that were said, some wait by it,
Okay.
or check it, sorry.
Play it again.
Okay, I understand. Is there...
I'm not going down my back towards my fetus to be able to go. And his own charge out to the court. Thank you.
Were you able to hear what she said then?
It's very jumbled.
Okay.
Oh, okay. So what is your first name?
Alexandra.
Okay, we do have help on the way. Okay, Alexandra. I just want you to leave the fetus where it is so the paramedics can...
It is.
Now, why did you tell her to leave the baby where it was?
At this point, she was hemorrhaging, so I wasn't going to send her to go looking for it or back to where it was, because she was in a medical emergency.
Okay, so now your focus has shifted
Yes,
to what?
she's the patient.
Okay, so based on that, you were now, based on what she had told you, you were not concerned about the baby at this point.
Saying not concerned is kind of a weird word. I was shifting my focus to her for the patient, because at this point, she was the one that was there with the medical need.
Okay.
I know you said he's keeping an eye out to see where it is, okay?
I don't know where it is because I do come out one person and one like right after.
Oh,
Now, what did she say then about the location of the baby?
We know where it is.
Okay.
They're both kind of one last minute and then the other was down one.
okay, and I know you said you still had the cord attached to you, correct?
Yeah.
All right, listen carefully. I'm going to tell you what to do next, okay? I want you to find some towels.
Now, when she said, we know where it is, I just want to follow up. Did she provide any specific location where it was?
No,
Had she done that, would you have provided that to fire?
yes,
Or something.
I have a something wrapped around me right now.
All right, I want you to place that under you.
Hey.
Okay, and a blanket and a large towel to keep yourself warm, okay? Place the towels under your bottom. Place the towels under your bottom and like...
And now, what are you doing here during this portion of the call?
I'm putting her in a position to start giving her further instruction.
Okay, so you're now,
I'm instructing her to get on the ground, put a towel under her.
okay, so at this point, I think you mentioned it before, she's your patient now. And so you're focused on getting her treatment and help until fire comes?
Right.
Down, on your back, not down.
Okay.
Okay? I'm just going to try to help you. Alexandra, listen to me, okay? I need to tell you how to stop the bleeding, okay? But I want you to make a fist with your hand and place it just above your pubic hair, right near your belly button. Do you understand how far?
On the area of, I keep like, my, right on the area button before my layers of hair.
Right, just above the hair, okay? Do you understand me so far? I want you to press down with your fist and apply firm but gentle pressure. Don't let up, okay? This may briefly increase the bleeding or cramping, but you have to keep doing it. This will help stop the bleeding or cramping. Okay? All right.
Now, at this point during the conversation, is she following to your knowledge, is she following your instructions?
Yes.
And was she able to relay any information back to you as she was following those instructions?
Yes.
Okay.
All right. You're going to press your fist down and apply firm but gentle pressure. Don't let up. You're going to keep your fist pressing down, okay? This is going to cause the bleeding to become heavy again and some more cramping that could happen. But you need to keep doing this. This is going to help. This is going to help stop the bleeding, okay? How are you doing?
I'm okay.
All right. Has the bleeding stopped or the cramping stopped?
All the instructions I did for the...
Okay. So just the bleeding. Are you still bleeding or are you still bleeding?
Yeah.
Okay. And you may, but if you're bleeding seriously, you need to make sure you keep doing that pressure. Make sure somebody's keeping an eye out for the ambulance so they can direct them to where you are.
I'm sorry. Did you say keep that eye out for the ambulance?
Now, you provided her an instruction there, correct?
Yes.
And what was that instruction?
Bleeding control.
Okay. Did you also instruct her to keep an eye out for the ambulance?
I instructed her to have somebody keep an eye out for the ambulance.
Okay. And did she relay to someone your instruction?
Yeah.
Okay.
Oh, just was coming. We just get a phone and make sure that everything's safe.
No, I know what you mean, and that's fine. Okay, at least you're gonna get some treatment, okay? It's hard. It's hard.
I don't know how long we'll be there. Or I get really bad anxiety when it comes out of the hospital.
Okay, I don't know. It could be something that you're in there, you get checked out, they take care of whether they need to. But you know, the hospital's been really, really busy, but this is a little different, okay?
Yeah, I'd like to.
So now at this point, what are you doing with the caller?
Trying to calm her, reassure her. She was scared. She was wondering how long she would have to go to the hospital for or be there for. She said that she had real bad anxiety. So I was just trying to reassure her that they're going to take care of her to the best of their ability at this point.
And now, as part of your training and experience, when you have people going through these types of emergency situations, is this part of what you do
It is.
to reassure
Keep
them?
it calm
keep
and
them calm?
reassuring and be that voice on the other end of the line when there is something that they're trying to hold on to.
And you're doing so until fire comes.
Correct.
Or rescue comes.
Right.
At that point. Okay.
You boys are up on this one.
Yeah, well, with the
It's
bleeding,
very, very slow. Like, I've heard that with the other on court, it's called, if it doesn't get caught, it's even though the English soccer man, that's where the light and that stuff comes in.
it depends. I mean, this just happened, right? So it's not something that's in your body, it's not an infection.
No.
Okay, so
It's nothing but the walk.
when it's something that hasn't come out, like, for some time after you have the baby, it's usually something that causes an infection, because you're getting looked at right away. So I don't think we're going to be in that type of life or death situation right now. Okay, and that's why we're trying to control the bleeding. Okay, are you still bleeding?
Yeah.
Okay.
A little bit, not bad though, not bad one.
Good, yeah. This is,
And what did you ask her right then about whether or not she was bleeding?
They asked her if she was still bleeding.
Yeah, was she able to relay information back to you in real time?
Yes.
this is what causes it to try to see. So you're doing great. I know it's not an easy situation. I'm sorry. This is what you're going through. And of course, obviously surprised.
It's not family drama, so I got something to watch, you know?
Right? Well, you made it past Christmas. It's after midnight.
I know.
So it's not a Christmas Day memory for you, thankfully.
I still have to say something else to me, so.
I know what you mean. But I mean, if you try to look at it this way, it's a little bit easier to think about it not actually being Christmas Day, okay?
Yeah.
That way.
It's a little easier now knowing I won't find it. So I know what to look for in the future.
Yeah. Well, I mean, you never know. And, you know, maybe somebody can just tell you what, what your chances are of this happening again or not. Yeah. All right.
Now, so you're having a conversation about whether or not this could happen again or not, correct?
Right.
Right. Now, at this time, and really throughout this entire time, were you under the assumption that you were working with a non-viable baby?
Yes.
And again, where did that information come from?
At the beginning of the call when she gave me the information stating that she couldn't have been more than 3 months alone.
It just wasn't time, I guess. Those are happen. These things are spontaneous.
Honestly, in my experience, I know for a fact that I'm not going to have kids in my mental state, right?
Okay.
I know that's hard to not have this happen before.
Sure.
And then every year problem, which is a very, very high risk of getting anything.
Yes, it is. It is. But, it is what it is, and we all learn from everything we experience in our life.
But knowing that I'm not ready, and knowing that I could break into this world myself, I couldn't do that because it would be putting myself in a situation my parents were when I was born.
Okay. I'm just going to update the rescue and just let them know what's going on so far, okay?
Thank you.
All right, you're welcome. All right, I'll be right here until help's with you, so stay with me. Hi, 718-134, referencing your medical on Electric Street.
Okay.
There is somebody keeping an eye out for you, so they can direct you to where she is, because I got her off her feet, doing a frontal massage to stop the bleeding. She was probably less than 3 months pregnant, maybe not viable,
Okay.
but she still has the cord attached to her.
Okay.
And it's serious bleeding that we've been able to control.
Okay.
Okay?
Can you just So you call back in now during this part of the call. You call back into fire to provide them with an update. If you just recap again, what did you tell them?
I told them what was going on with the call, what was going on with the patient, and the status of the caller and the baby.
Okay, and what did you tell them again with the baby?
That it was she was less than 3 months along, and that the baby was non-viable.
Okay. At that point, had you received any information from the caller that the baby was crying?
No.
Had you received any additional information from the caller? Now we're almost 11 minutes into the call about where the baby's location was.
No.
So you had to provide that type of information to fire when you called back for that update.
Right.
Had you received that information, would that have been something that you would relay to fire?
Yes.
But are she located actually under the overpass or down by the ice area? This trestle? So
It's as you come down, Kelly 3, so you're gonna come down. What's the height of that road?
Okay, so during this portion of the call, was fire looking to confirm the location?
Yes.
And what did the caller say with
She
respect
was
to her location?
at the trestle.
Was there any additional information about the baby at that point?
No.
There.
yeah,
Bremer Street? Yeah, as you come down Bremer Street, they're more close to where the trestle is, so you could go right there. Oh, perfect, yeah, please look at someone else to meet the ambulance. The boyfriend is, okay. Alexandra, let me know when the rest is there with you, okay? The bleeding stopped?
The bleeding still going, but no, it's not, so.
Okay, it's important, okay. Now, I know it's not as bad, but keep doing the massaging, okay? Make sure we keep it under control, okay? It's important for you to keep talking to me, though, so I know you're all right. You're doing
I'm ready to so.
okay? And try to use the blanket and try to keep yourself warm. I know it's not easy outside. It's very cold today. If anything changes, tell me immediately, okay?
Okay, thank you very much.
The rest of you there?
Yes, sir.
All right. Take care of yourself.
Thank you very
You're
much.
welcome. Bye. Thanks.
You know, Ms. Packard, so the call was approximately 12 minutes in length. Did you know where the baby was at the end of it?
No.
Were you provided any information as to its location?
No.
No further questions, thank you.
Council Coach?
Ms. Packard, I wanted to talk to you a little bit about the call we all just listened to. The first caller you spoke to was a male,
Yes.
and later in the call, the female announced that the male's name was George.
I don't recall.
You don't recall? Would it refresh your recollection to listen to a clip of the body-worn camera? To see what she said. I mean, the body-worn camera, I'm sorry, the 911 call.
I guess to,
So that you can hear what was said.
yeah.
And this is State's Exhibit 24, but I'm playing the defense's USB, which is the same thing, marked as III for ID only.
Conversation recorded.
Does that refresh your recollection about whether she said the male was her boyfriend?
Yes.
And she said the male was her boyfriend?
Yes.
Does that refresh your recollection about what she said
Yes.
the male's name was?
Yep.
And his name was George?
Yes.
And you asked the male to provide his phone number,
Correct.
and he provided it to you. Sorry, is that a yes?
Yes, I'm sorry.
No, that's okay. And you read it back to him, and he confirmed you had the correct number.
Right.
It was difficult to get information from the first caller, George.
Right.
You asked, what happened? Sorry, is that a yes?
Yes. Sorry.
No, that's okay. I know it's not a normal way of speaking. And George didn't answer you. He put the female on the phone.
Yes, he did.
And you later learned that that female voice was Alexandra.
Yes.
She told you she goes by Allie.
Yes.
And Allie sounded like she was in distress.
She did.
She was breathing heavy.
Yes, she was.
She was crying at times.
Yes.
And on direct, you said she sounded scared.
Yes.
She told you she had no clue she was pregnant.
Yes.
She said that multiple times.
She did.
She told you she was having a hard time.
Yes.
And she clarified that she was standing right on the path to the entrance of the trestle on the side of Electric Street.
Yes.
Allie told you she had 2 kids,
Yes.
that the cord was still hanging out of her.
Yes.
Allie was particularly concerned about the cord. You guys talked about that a decent amount.
Yes.
She said she needed it to be cut to make sure she could live.
Yes.
She thought that it could cause her to die.
Yes.
And on direct, you mentioned the first time you asked Allie how far along she was, that she said 1 month.
I believe so.
Are you positive that's what she said, or would it be helpful to have that closer up to you so that you can be sure?
She gave more than one answer
Okay,
at
I'm
different times, so I can't remember which one we're talking about.
Okay, so is it fair to say the first time she said that there's no way she was 9 months?
Yes.
And then the second time she said, maybe I was 3 months along at most, there's no way I was any more than that.
Right.
And then the third time you said, how many months pregnant are you?
Right.
And she said, there was no way I was more than 3.
Correct.
She didn't say 1 month.
I would have to hear it again.
Okay, so would it refresh your recollection to listen to the beginning portion of the call to see what she said about that?
Yes.
This is defense's exhibit III for ID, same as state's exhibit 24. And I'm going to play for you from the very beginning of the call to 3 minutes and 18 seconds in, and you tell me if you want me to play more than that.
Okay.
And Judge, just for housekeeping, because this is a full exhibit, I'm not going to play it very well.
Conversation recorded on Monday, December 26, 2022, 24 minutes and 12 seconds.
There's someone with your emergency? Okay, where are you exactly, sir?
Outside, I shouldn't have to be Hampshire.
Okay, are you right in front of it, inside, or? I'm sorry, sir?
By the Flushing Bridge.
By the trestle? Okay.
Yep.
And what town? Okay. And your phone number, that's in Manchester, 1 Electric Drive by the trestle, by what side are we at? What's the phone number for you?
858-480-6951.
Okay, just to confirm, 858-480-6951. Tell me exactly what happened.
Hello?
Hi, what happened?
I had no clue that I was pregnant. There's no way I'm going to belong.
So is that fair to say that was the first time that
Yes.
we talked about this, right?
Yes.
And what Allie said was, I had no clue I was pregnant and there's no way I was 9 months along.
Yes.
When I just found out the case,
Okay, they're already being notified, okay? All right. I need you to tell me exactly
You're
what
not the
happened.
ice arena, okay?
Okay, are you by the trestle, though, or are you by the ice arena? Are you by the arena or the trestle? I'm sorry, it keeps breaking up. You're by the trestle. Okay, stay there, okay, so we know where exactly you are. Okay.
Me and my boyfriend.
Did you already have the baby?
Right now, because no.
Okay, I'm just confirming, okay, so they're being
No,
notified.
it was kind of like a...
All right, I'm sending from Manchester. I'm sending from Manchester. Ambulance, stay on the line. I'll come back to you.
And for the record, this is the first time that you're calling the local dispatch and updating them.
Right.
Hi, now 18134. Request for an ambulance in Manchester City, the trestle, down by the ice arena off 1 Electric Avenue. I don't have a determinant. I had a hard time getting information. It's my first caller. I have a female on the line saying she just gave birth. She didn't know she was pregnant.
So maybe I was 3 months along at most.
And that's the second time you guys have talked about it, right?
Right.
And she said, maybe I was 3 months along at the most.
Yes.
There's no way I was any more than that.
She says, no way I was any more than that.
Correct.
No way. Yes, I'm standing right at the top. The entrance is not so ugly.
And the local dispatcher tries to clarify. Is she saying she's under the trestle? Right? That's what he says?
Right.
And then she says,
There's no way I was any more than that. No way. Yes, I'm standing right at the top. The entrance is not so ugly.
and she clarifies, I'm standing at the entrance to the path at the trestle.
Right.
She doesn't lead them to believe she's under the trestle.
Right.
Side of the left street.
Okay. All right, we'll be right there.
Thank you. All right, ma'am. How old are you? 36? 26.
That's me, right?
Okay. Yep, they're on the way, okay? Just stay right on the line with me, okay?
Thank you very much.
All right. How many months pregnant are you?
There's no way I'm going to sleep.
No more than.
And this is the third time you guys are talking about potentially how far along the pregnancy might have been, right?
Right.
And she says there's no way I was more than 3.
Right.
And so nowhere in those 3 times where you guys are talking about that did she say 1 month.
No, I don't hear it.
And on direct, the state had asked you about the second time you guys are talking about that, right?
Right.
And that's when you said it was 1 month, but we learn now when it's a little bit closer to you, that's not what Allie said. Is that a yes?
Yes.
Sorry, I know it's weird. Usually in life, we just nod our heads to people. And on direct, you said that you didn't have any information about where the fetus was, right? This prosecutor asked you that a ton of times, didn't he? Sorry, is that a yes?
Yes, sorry.
No, it's okay. But you asked Allie, where is the fetus?
Yes,
And you used that term because at that point you did not think the baby was alive.
correct.
And she told you, quote, on the ground on the other side of the trestle.
I remember on the ground,
Would it refresh,
possibly on the other side of the trestle. I don't remember.
would it refresh your recollection to listen to that portion of the call?
Sure.
This is defense's triple I for ID, prosecution exhibit 24. I'm gonna reopen it.
Conversation.
Yeah, the eyes of the cord that's supposed to be cut when you have the kid.
Right.
Still hanging out of it.
Okay, where's the fetus?
On the ground. On
Do you have any?
the
Do you have any?
Does that refresh your recollection?
That's more clear.
And what she said was on the ground on the other side of the trestle. You would
Yes.
agree with me, that's what she said. Sorry, I just want to make sure we were talking over each other. I'm sorry about that. What she said was on the ground on the other side of the trestle, correct?
Correct.
And could you see the time on the 911 call?
I could, but I didn't look at the time.
Okay. I'm going to ask you about the time, so I should be. I'm just going back 10 seconds.
Okay.
Can you take notice of the time?
Have the kid.
Right.
Still hanging out of it.
Okay, where's the fetus?
On the ground. On
Do
the
you have
other
any?
side of the trestle.
Do you have any?
So that was around 3 minutes and 56 seconds into the call.
Yes.
And you never asked her to further clarify that.
No.
But you did ask another question. You said, you're not where the fetus is.
I believe so.
And Allie told you no.
Correct.
She told you her boyfriend went back to where the fetus was to get his phone.
I didn't remember the part about the phone, but yes.
Is that your memory now after you've listened to the call?
I don't remember hearing the word phone.
Okay, would it refresh your recollection to listen to that part of the call? Sorry, is that, yes, okay. This is defense's triple I for ID and state exhibit 24.
So you're getting the cord cut and make sure that I left it.
Okay, I understand. Is there?
My boyfriend went back towards the fetus to be able to go and his phone can charge up so he can contact me.
Does that refresh your recollection?
Yes.
Okay, and what Allie said was her boyfriend went back to where the fetus was to get his phone. Is that a yes?
Yes.
You told Allie, leave the fetus where it is.
Right. Yes.
And you also wanted to make sure the paramedics could see Allie when they arrived.
Correct.
Allie told you after the first delivery, the fetus lasted for only 1 minute.
I believe that was the cramping.
Okay, would it refresh your recollection to listen to that part of the 911 call to know what Allie said about whether or not one of the fetuses lasted for 1 minute?
Yes.
Defense exhibit triple I for identification, state exhibit 24.
He kind of had two come out, one first and then one like right after. They're both kind of, one lasted a minute and then the other was dead on spot.
Okay,
And what you and Allie were talking about is the 2 deliveries she thought she had.
Correct.
And does that refresh your recollection about whether Allie told you that the first delivery, that baby lasted for 1 minute?
She said one lasted for a minute. Yes.
And she said the next died on the spot.
Right.
You were realizing that Allie was bleeding a lot.
Yes.
And that prompted you to tell her to lay down.
Right.
You wanted her to place a blanket and a large towel under herself.
Right.
But she told you she didn't have anything like that.
Right.
Just the blanket that was in her pants to absorb the blood.
Right.
You told her, don't sit up.
Correct.
And that's because that would not at all help the bleeding from stopping.
Right.
Standing up could make the bleeding worse.
Yes,
And we're hearing you explain to her how to do her own fundal massage.
correct.
And tell me, if you don't know, that's fine, but a fundal massage is painful.
Yes, it is.
Typically, women aren't doing their own fundal massages.
No,
And you kept checking in with Allie to make sure she was okay. You were worried about her.
yes,
You recognized that she needed to go to the hospital.
yes,
And when you were communicating to her that she needed to go to the hospital, she asked how long she would have to be there.
correct.
She told you that hospitals give her really bad anxiety.
Yes,
You were trying to console Allie,
yes,
telling her to try to not think about this as a Christmas Day memory.
correct.
She, is sort of going along with that. She says, well, this will give her something to look forward to in the future, maybe.
Yes,
And you encouraged her. Maybe this just wasn't her time.
I don't remember my exact words with that, but yeah,
Something to that effect. Is that fair?
yes,
And you were trying to be nice because she was clearly upset.
yes,
And you didn't want her to think this was her fault, so you told her these things are spontaneous.
yes,
She told you she didn't want to put herself in the same situation her parents were in when she was born.
correct.
At that point, you didn't really know what she meant by that.
No.
But you continued going along and encouraging and consoling her.
Yes,
After you calmed her down for a minute, you decided to update rescue.
correct.
And you didn't tell rescue that at that point you knew she had said the fetus was on the ground on the other side of the trestle.
No,
You told rescue that Allie was probably less than 3 months pregnant.
correct.
You said out loud that the baby was not viable.
Correct.
You communicated to them that you believed the cord was still attached to her body.
Yes,
You checked in with Allie to make sure she was still on the phone.
yes,
She said, I'm right here, I'm still alive.
yes.
If I can just have a moment. Nothing further for this witness.
Sorry if I just stay at the table, Your Honor.
Yes, ma'am.
Thank you. So, Ms. Packard, all of the information that you relayed to fire dispatch came from the caller?
I believe so, yes,
You believe so, or
Yes.
was she your primary source of information?
Yes.
She's the one that you relied on?
Yes.
She's the one that you asked questions of,
yes,
and she is the one that responded to you.
correct.
Now, the call lasted approximately 12 minutes.
Yes,
At the end of the call, did you know where the baby's location was?
no,
I have nothing further, Your Honor.
Ms. Packard, what you knew at the end of that call was that Allie had said the fetus was on the other side of the trestle bridge. That's what she said to you.
today, that is what I heard.
And that is what Allie said on that call.
Yes,
Nothing further.
All right, counsel approach.
Ma'am, please sit down.
And you are excused. Does the state wish to call any additional witnesses?
No, Your Honor, state rest.
All right, ladies and gentlemen, the state has now rested. What we're going to do is I'm going to release you for lunch now. I'm going to have you come back at 1:25.
Hi, I just wanted to do a little side note and let you guys know that when they're going through the photographs and the evidence, they are handing the physical photographs to the jurors and they are not displaying them. So you're not missing out on anything. And thank you for watching. Oh, and one other side note. Alexandra is the adopted daughter of Dennis Eckersley, who is a multi-millionaire baseball Hall of Famer for the Boston Red Sox.